you can't have that. You can't have that.
Hello, everyone, and welcome to this week's Cuyahoga County and Board of Health media briefing. My name is Debbie Giannetti, and we are joined here with a few folks, including County Executive Armond Budish, Board of Health Commissioner Terry Allen, Board of Health Medical Director Dr. Heidi Gullett, President and Chief Executive Officer of Neighborhood Family Practice, Jean Polster, as well as Board of Health Co-Director of Prevention and Wellness, Ramona Brazil. We're going to start off with County Executive Armond Budish, and then as usual, we will go through our folks and then take some questions at the end. I ask the media that is called into the WebEx to please remember to mute themselves when they are not asking a question. So we're going to go ahead and get started with Executive Budish. Thank you very much.
Thank you, Devin. Good afternoon, everybody. I appreciate the opportunity to provide these weekly updates to the community. And as always, I want to express my thanks for the County Board of Health and all they do to protect us. I want to start this briefing off by addressing the tragic killing of Detective James Skirnovitz. My heart goes out to his family, friends, and fellow police officers. Detective Skirnovitz served 28 years on the Cleveland Police Force. As an undercover officer, he was on the front lines. His work included fighting against gangs and drugs. Last night, he was shot down. Police officers throughout the country and the county put their lives on the line every day to protect us from crime and danger. That statement should not be a flashpoint or controversial, but unfortunately, these days it is. I'm grateful for Detective Skirnovitz's service, and I pray for his family. This year has been, well, extraordinary. I know I've heard from many people that they just want 2020 to be over. It's been hard, really hard. We've lost loved ones. We've lost jobs. We've lost our businesses. And right now, at least, there isn't an end in sight. But there have been important and necessary developments, too. This crisis has laid bare long-standing disparities that harm Black people and other people of color. We're intent on attacking this structural racism. Cuyahoga County and County Council declared racism as a public health crisis, and I wanted to give you all an early update on our progress so far. First, we established both an internal and an external group to look at the problems. The internal group is made up of county leadership and is tasked with reviewing our policies and practices in a number of departments, including Health and Human Services, Department of Development, and Public Works. They're going to be taking a data-driven approach to understanding whether or not our practices are effective and how we can improve our outcomes for minorities. The external group, called the Citizens Advisory Council on Equity, is made up of 17 local civic leaders from all areas: business executives, nonprofit leaders, religious leaders, and others. Their chair is Eddie Taylor, who's the former president of the President's Council and a longtime leader here in Cleveland. Cuyahoga County Clerk of Courts Nayla Bird serves as our county liaison. The Advisory Council is charged with reviewing, focusing on, and providing recommendations to reduce disparities between Black and white people with regards to healthcare, criminal justice, access to healthy foods, safe and affordable housing, well-paying jobs and economic opportunity, quality transportation, educational opportunities, and safe places to be active. It's quite a list. And let's face it, these issues are complex and long-standing. To help provide direction and focus, Dr. Peter Armond of Case Western Reserve University will help inform the Council's work. Dr. Armond is internationally renowned in the use of systems analysis. And we want to hear from community members. While we have 17 terrific, strong, committed individuals on this council, it's crucial that we include voices from all over the county. The council has established a communications subcommittee chaired by Phyllis Harris, who's the executive director for the LGBTQ Community Center of Greater Cleveland. This committee will be creating a platform for community input in the coming weeks. Meanwhile, the council's meetings are public. You can find information on their meetings and watch a live stream of their meetings at cuyahogacounty.us/CAC. There's a link to the page right off of our county homepage. Anyone who wishes to express an opinion or bring up a matter for the council can email them at equity@cuyahogacounty.us. Speaking of expressing your opinions, there's no more important way to have your voice heard than voting. This week we got the news from the Secretary of State that more than 115,000 registrations across the state will be purged because of lack of activity, and more than 21,000 of those people are from Greater Cleveland. Now, those names won't be taken off the voter rolls until after this November election. And your name won't be purged at all if you vote in this election. So please vote. To avoid standing in a long line on election day, send in your vote by mail. You get an application. You've gotten one already sent to you by the Secretary of State. You don't have to send in a second one if you'd already have one. And send it in now. Your ballot will then be sent to you on or around October 6th. If you then fill it out and send it back immediately, there should be no concern about getting your vote to the Board of Election in plenty of time. Switching subjects, we received great news this week about $5.6 million in funding from the U.S. Department of Transportation for our Cuyahoga County Airport. For those of you who don't know, we have an airport. The county has owned and operated the airport since 1946. It's about 11 miles outside of Cleveland in the communities of Richmond Heights, Highland Heights, and Willoughby Hills. Flights are down due to COVID, but on average over the past 3 years, there have been about 25,000 aircraft operations, that's takeoffs and landings, each year. It's an important part of this region's airport infrastructure and our county economy. These funds that we received are designated for reconstruction of a large part of the apron and taxiways. The work is critical to keep our airport as a first-class and safe part of the national airport system. Normally, in order to receive funds of this kind, the county would have to do a 10% match. So that would be about $560,000. But under this year's CARES Act, Congress provided for 100% of the funding. So not only are we happy to receive the grant, we're doubly happy to save over $500,000 from the general fund that would normally have had to go to be our local match. I especially want to thank Congressman Dave Joyce from the 14th Congressional District who supported this funding for us. Thank you. Finally, it's almost the holiday weekend, and I want to encourage all Cuyahoga County residents to go outside. Enjoy the weather. It's supposed to be nice. Enjoy being with friends and with family. It looks like it's going to be a beautiful weekend. We have so many great places and ways to enjoy the outdoors here in Cuyahoga, from our beautiful lake to the trails and woods in the metro parks. This week, I was able to tour the third stage of the Towpath Trail. We now have more than 100 miles of connected trails that run from Cleveland through 4 counties. I spent some time walking this new section, and it is stunning. It fits perfectly with our long-term lakefront access plans for a bike and walking path all along our lakefront. I want to thank our Public Works Department for running the construction projects associated with the towpath over the years, and I want to thank all the many partners who have made this Ohio treasure a reality. Canalway Partners, the City of Cleveland, the Metro Parks, and NOACA. It's been a real good collaboration. Thanks to all. And please, everyone, stay safe and healthy this weekend. Now I'd like to turn it over to Director Terry Allen.
Thank you, Executive Budish, for your championing of public health and for your partnership and leadership that's been ongoing since the beginning of this pandemic response. We're in a different room today. We're having some technical difficulties, and so we'll be doing some musical chairs with Dr. Gullett and co-director Brazil as we move through our presentation, so bear with us. So yesterday, September 4th, Governor DeWine announced, September 3rd, Governor DeWine announced that Cuyahoga County remains at risk level 2 of public health emergency, or orange, in the Ohio Public Health Advisory System. Counties at risk level 2 are advised by the Ohio Department of Health to exercise a high degree of caution. This continues to be good news, and an indication that our county is still moving in the right direction. Increasing mask use, physical distancing, hand hygiene, surface cleaning, remote work, and staying home when you're sick are all part of the prevention equation. Our continued vigilance is in following the prevention guidance is essential. We plan to continue to follow the data trends over time to make informed decisions and understand the trajectory for our decision-making process. As of yesterday, countywide, there are over 15,965 cases of COVID-19 that have been reported across the entire county, including the city of Cleveland, with 15% of these cases, or 2,448 people requiring hospitalization. This is by far the highest number of hospitalizations of any county in the state. Of the total cases, 3.7% or 591 people have died since March. Our family members, our friends, our grandparents, our neighbors. And remembering that is critical as these very, very tragic death toll continues to rise in this community. You'll hear more from Dr. Gullett on the data specific to our jurisdiction. It's clear that this coronavirus continues to spread easily, and people without symptoms can unknowingly transmit the virus to others. Infectious diseases don't recognize boundaries on a map. We understand from our case investigations that people move around widely across the region and beyond, with exposures often happening outside of the immediate community where a COVID-19 case may reside. I know that everyone's looking forward, as we look ahead here, to our Labor Day weekend. We wanted to provide a reminder about the importance of the continued vigilance on the proven prevention measures to reduce the risk for the spread of COVID in our community. Our epidemic curve that you'll hear about in the data brief clearly demonstrates the major surge that occurred between mid-June and mid-July, the largest surge in cases since the start of the pandemic. During that time, we went from 213 cases a week to 919 cases a week. This surge was clearly exacerbated following the July 4th weekend, where folks went out, and unfortunately, we didn't see the level of masking and social distancing that were necessary to try and prevent community transmission to the degree we would have liked. We now know that a walk in the park is much safer than large gatherings of people close distance without masks. We all want to avoid another surge, and the best way to do that is to follow the prevention guidance and celebrate safely over the Labor Day weekend, and we encourage you to do that. So turning to schools, this afternoon, the Ohio Department of Health released the order just about an hour and a half ago for school reporting in Ohio. According to the order, beginning Tuesday, September 8th, parents or guardians and school staff should notify their school within 24 hours of receiving a positive test or a clinical diagnosis. Within 24 hours after receiving that notification, the school should notify other parents and guardians about that case in writing, providing as much information as possible without releasing protected health information. The school must also notify their local health department within 24 hours. Beginning Tuesday, September 15th, and each Tuesday thereafter, local health departments will report the number of newly reported and cumulative cases of COVID-19 to the Ohio Department of Health. The Ohio Department of Health will publish these data by school or school district, including a breakdown by students and staff each Thursday. This process is very similar to the uniform reporting procedure that was developed under the governor's order for long-term care reporting that began in spring, and we've been following that process since that time. The order will also require each school district or school to identify a COVID-19 coordinator to facilitate the reporting of case information, and upon request, schools or buildings are required to provide the local health department a copy of their pandemic plan. Finally, thanks to the media team at the county administrator's office who have organized and facilitated these regular virtual briefings. Scott, Devin, Mary Louise, Jonathan, Eliza, working closely with Kevin. Their talents and collaborative spirit in service of the public are greatly appreciated. Thank you for your time and attention. And now I'm going to get up and give the computer over to Dr. Gullett.
Thank you, Terry. So I'm going to review the data for this week. You heard Terry already mention a little bit of the data, but we're going to walk through our epi brief, and then we'll hear from Jean Polster. So you saw that we had 479 new cases this week. Our trend graph on the difference of cases will be on our website immediately after this. We also, unfortunately, lost 27 members of our community this week to COVID-19 as well. So we continue to see pretty significant trend in sustained deaths, which is concerning to us. You heard Terry talk also about some hospitalizations. Overall, since the beginning, about 10% of the individuals in our jurisdiction have been hospitalized at some point during their infection, and that still includes children who've been hospitalized due to COVID-19, as well as some of those children requiring intensive care unit treatment. Also, just for reference, about 10.2% of our cases thus far have been in children. So that gives you an idea of the percentage of cases as well in that age group. And finally, this is not on our epi brief, but I wanted to give viewers an update on our median age for cases, because it does continue to come down. So the median age overall for cases from our jurisdiction since the beginning is 42. And you'll recognize that if you've been following us for a while, that median age was much higher early on. And so we've seen increase